A lot of parents have questions about cold sores, and they're actually very common. Half of adults in the United States have had a cold sore at some point, and most kids are exposed to them sometime between the ages of 1 and 5, so at a very young age. And the first outbreak is usually the worst. Usually the blisters develop around the lips or the mouth, but on the first exposure, they may also spread to different parts of the face, like the chin, the cheeks, the nose, and on the inside of the cheeks, and it can even go down the throat. The virus can even be spread to the eyes, and if this happens, it's called herpes simplex virus or HSV keratitis, and it's an infection of the cornea which can cause blindness. The herpes simplex virus or the cold sore virus is especially dangerous to babies that are 6 months of age or younger because their immune systems are still developing. And so if a parent or an older child gets a cold sore, they should be especially careful around babies and also be careful to not pass it to other small children. Cold sores spread through saliva and skin-to-skin contact, as well as touching the secretions from the blisters or the saliva of another person after they've touched an object, and then you come along and pick it up. And so there are definitely things you can do to prevent this spread. If you're an adult and you have a cold sore, don't kiss a young baby especially, or another child, or another adult. And this will help to prevent the spread of it from skin-to-skin contact and also through sharing saliva. Of course, there are other ways that saliva is shared, and oftentimes kids don't think about this. You want to make sure that they're not sharing utensils with each other or straws or even toothpaste, and that they don't accidentally pick up another person's toothbrush when they have an outbreak. Also be aware of towel usage. If they should use their own towel when they have an outbreak, and those should be washed in warm water afterwards and not shared with any other people in the house. Also encourage the person who has one to wash their hands frequently, because often, especially kids, they'll pick at the blisters and then they have that on their fingers, and it can also spread to other parts of their body. And so it's really important for them to wash their hands for their own well-being and for others. After an active infection, the virus doesn't go away. It can't be treated. That person's going to have it forever. It will go lay dormant in nerve cells of the body for varying lengths of time, and then for whatever reason, it may be triggered and it goes back up to the skin and causes another active infection. Common triggers can include fatigue, stress, overexposure to the sun, any illness or dehydration, and for teenagers, even hormone changes that they experience, especially when girls have menstrual cycles and when both boys and girls are going through puberty, it may cause flare-ups. Do what you can to avoid these triggers for yourself and your children. And when you do get a cold sore or your child gets a cold sore, the best thing you can do is just help to ease the discomfort through its course. And they typically blister and then form a crust afterwards, and then the skin heals. And so that's what you're looking for as you watch the healing process. If a child has a lot around their mouth, they may not want to eat or drink. And then the secondary issue of infection from the sores becoming infected and also dehydration can set in. So you want to do what you can to watch the area, make sure that it's not developing an infection. If the child starts to run a fever or the blisters or sores or rash that you're seeing begins to spread, it may be something else, or they may have developed a secondary infection. And so if you just feel like it's not healing or if it's spreading, then you need to call the pediatrician and have them take a look at it. To make sure they don't become dehydrated, offer them things that are going to be soothing, and usually that's something cold. So popsicles, smoothies, slushies, those are all good to give a child. Even just plain old cold water, they'll usually welcome that. You can even give them like a cold pack to put on it or a warm washcloth. Just make sure that no one else touches those things or uses them. And also avoid giving the child anything acidic or salty or anything with a zip to it, like anything with vinegar, because of course that will all aggravate the problem and make it hurt worse. You can also talk with your pediatrician about over-the-counter pain relievers if it's a young child that isn't eating, drinking, or sleeping because of the discomfort, and they'll be able to tell you what medication and dosage is appropriate for your child. You can also talk to the pediatrician about antiviral creams, which tend to shorten the course slightly, and the doctor will determine if those are good for your child and their history of infection. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.